Hey, Margie here. May is Osteoporosis Awareness and Prevention Month. And today we're talking about testing, which is one of the most important pieces when we're trying to figure out the puzzle. What may be our root cause or causes of bone loss? And today I'm just thrilled to have with me Dr. Kim Millman. Dr. Millman is a Stanford, UCSF, USC trained integrative medicine physician and research scientist. She has been working for over 15 years helping women with bone loss discover why their bones are thinning, reverse the root cause, and give them natural strategies to strengthen their bones. She is one of the only doctors that is specialized in this integrative approach to bone loss in the country. And she sees patients individually and teaches an online program called Restore and Rebuild 100 Days to Healthier Bones. And I'm just so thrilled because her mission, like mine, is to help women with bone loss go from feeling fragile, frustrated, and frightened to empowered and confident that they can take control of their bone health and continue to do the things they love. So Dr. Millman this past year did an incredible webinar for my community on osteoporosis testing. And I got so many thank yous from people that what I decided to do, I asked her to come back and could she share that on the podcast? Because this information is truly invaluable. So there was a lot of information. So what we decided to do is break it into two pieces. So we're going to have part one today. And she talks about all sorts of different testing that can be done and how she uses that information. And there's a lot she talks about. So don't feel you have to understand all of it. Listen, take it in, but this is very, very powerful. And she's going to offer everyone this free interactive tool, which can also help you put the pieces together. So lots of great information. Stay tuned. Welcome, Dr. Millman. I'm so excited about this podcast because this information is just so important and really changes how people treat the osteoporosis and really changes lives. So before we even get started, I'm so excited that you're here, but why don't you just let people know how you got started? Because there are very few people with your credentials that have been specializing in osteoporosis for over 15 years. So why don't you just share a little bit about how you got started working with people with osteoporosis and how this developed?
Yeah, of course. Well, I'm really honored to be here. And so very early on in my career, what I noticed was how absolutely common this diagnosis was. And so, you probably already know that osteoporosis and osteopenia are the most common diagnoses of postmenopausal women. So that's exactly what I saw in my practice. And then, the absolute despair that I saw on people's faces and the fear and how, they felt like it was their genetic destiny. Their mom had osteoporosis. Their grandma had bad osteoporosis in the nursing home, broken hip, debilitated for the rest of her life. And really, I felt compelled to figure out how to evaluate and personalize a treatment approach for women with osteoporosis. And the best way actually to do it is to do a lot of lab testing and get down to the root cause. And so then I've developed a framework for which I do my lab testing. And that's exactly the webinar that I'm going to be giving to you today.
Oh, I'm so excited because when you did this for my community, I can't even tell you. So many people emailed me, thank you so much. I learned so, and they started to figure out, put the pieces together. And I think that's what it's all about. And that's, this is May is Osteoporosis Awareness and Prevention Month. And I think one of the best gifts we can give to people is to understand this piece, because this is what's missing so often in the conventional care, where there's medications and certain vitamins, but it's not, as you know, and as a lot of our listeners know, it's not one size fits all. So if we can figure out what's wrong, what may be missing, then we can, do the appropriate treatment. And as I always say, it becomes a blessing in disguise because not only do your bones get better, but every aspect of your life. And so the fun thing I'll just share with everyone is, let's see, Dr. Millman, you're going to be doing the class again, but so many people in my community have taken Dr. Millman's class and they've really been able to figure out, their situation. And it's just a win-win. So that's why I'm so thrilled. But what I'm going to do, I'm going to turn it over to you. And I'm also going to, so there are some things, so what I'll be doing is there's certain areas I want to interject as well. So we'll let you just take over. And, I just want to say how important this piece is. And but the good news is that we've seen it and it's doable. And that's what Dr. Millman is going to really share with you. And don't get overwhelmed if you're listening and thinking, oh my goodness, there's so many tests, and don't get overwhelmed because we also have Dr. Millman created this really wonderful, what would you call it? A lab tracker? What would you call that?
Well, we have the lab tracking tool that will be available on my website for free. And then we also have the lab testing guide. And then the lab testing guide is a nominal fee, but it actually goes through pretty much everything that's in this material. And it gives you additional codes. As I get into the data, I'll explain how the lab testing guide takes this a little bit further. And I also just want to add the fact that how empowering this data is too for people. You can take your health into your own hands. If you find that your doctor is not on board with doing some of this testing, I show you how you can get it done by yourself.
And even I think the other really great thing, and I know this is the two of us are on the same page with this, that oftentimes we just want doctors to learn about this. So many times people have brought information to their doctors and the doctor was thrilled and they incorporated that into the treatment. So it's not to, leave your doctor out of the picture. It's that you're knowledgeable so you can make sure that you're getting the best care that you can. So on that, we could go on and on. But on that note, I'm going to turn it over to you. What I just wanted people to know is don't worry about figuring everything out or hearing so many tests. That you'll have resources that you can go back to, but just know these things are possible. And I think that's really even if you did one of these tests, I think that could even help you on your path. So you just listen and know that the materials will be here to go back to. Okay, Dr. Millman. So I'm going to turn it over to you. Before we get started, I just wanted to let everybody know that Dr. Millman is going to be showing slides. You don't have to see the slides to understand what she's explaining. However, you can go back and see it either at my website, margiebissinger.com, and go to podcast, you can find it there, or also on YouTube. You can always see the video of this with the slides. But again, you don't need to, but just know it's there. Okay, Dr. Millman, we're all set for you to go.
Okay, so I'm excited to share this data with you, which is the essential lab testing for bone loss. So just want to let you know that you are in the right place if you're someone who has bone loss, who wants to identify the root cause of why your bones are thinning, or even if you're just hoping to improve your overall health, because analyzing and addressing the root causes for bone disease can help you become the healthiest version of yourself. So the types of tests that we're going to cover here today include standard ones that you might even have done by your doctor. These labs are usually done at LabCorp request. And so you might even find that these labs would be included in some of your basic wellness panels that your doctor runs for you every year. And then we're going to talk about some more advanced tests. These are tests that your doctor may not cover and may not request for you. And they would be done at LabCorp requests that dig a little bit deeper and are a little more specific to bone loss. And then there's functional medicine testing. And if you see a functional medicine doctor, some of these tests you may have already done, but these are the kinds of things that we look at, including food sensitivities and hormone panels, your stress levels, including your cortisol level, looking at your digestion and also your microbiome. So let's look at the root cause test that I offer in my clinic, and I do this in the restore and rebuild program that I have. So the bone turnover markers are probably one of the most important things that you can do for tracking where you are with your bone loss, and also for following up on interventions that you've done. Bone turnover markers are not only for following medications. This could be just a natural approach. So we have two bone turnover markers. The ones that I like to use the most are C-teleopeptide, or the acronym for that is CTX. And that is looking at how active your osteoclasts are. These are the bone cells that are breaking down your bones. So the higher the CTX, the more bone breakdown there is. And I find this to be absolutely essential. Also, the propeptide of type 1 collagen. This is also the acronym is P1NP. And on the flip side, this is how fast your osteoblasts are working and how much your bones are building. So you can look at the ratio of your CTX to P1NP and see how balanced these cells are. And when there's optimal values that we've established that help you to know if you're in a certain CTX range, your bones are likely to be pretty stable. And if they're above that range, then you know that you need to really work on bone breakdown. And I have a framework by which I separate the root cause factors into those factors that especially cause bone breakdown, and those factors, if they're missing, don't have as much bone building. So then you can focus on those root cause factors, and then you would follow the CTX and P1NP over time. And so I just find that these are absolutely essential.
Before you go on, I just want to add something to that. I couldn't agree more. So if you leave with nothing else, because so often you have a DEXA test and it doesn't mean anything because you don't know, are you actively losing bone, or as a child, you just didn't develop bone? We don't know. So these help us so often. And so many people in my community have said, I went to my doctor and the doctor says it's not an accurate test. And I know you go into this later, but do you want to share what people need to do? Because a lot of times the doctors don't realize a few things that they need to do to make it accurate when they order it. You want to share that now or just later on? Either way.
No, yeah, absolutely. So these tests need to be fasting. They need to be done as early in the morning as possible because biotin will interfere with the assays. You can't have biotin within 48 hours. And these markers are looking at what's called collagen cross-links. And so you can't have had collagen or bone broth within 48 hours of the test. And also you shouldn't be heavily exercising for 48 hours before the test.
Yeah, so I think that's one of the reasons that a doctor will have maybe ordered it and someone did it, at 8 a.m. You'd want to do it as early as possible. And then someone later in the day, and it's not going to be accurate. So I think that that's just such an important piece that everybody.
And I would also say that I don't think that a lot of doctors are really, if you don't have experience with these two markers, then the optimal ranges, you won't really know what those are because the normal range is huge. I mean, basically my optimal range is from on CTX is 350 to 250 to 350. So at 350, most people are not going to be losing bone. Some people at 400 may be losing bone, and many people at 450. After 450, almost everyone is losing bone. And your doctor may not have experience to understand this, but in my practice, I find this really predictive. So when my patients are 250 to 350 or even lower and their P1NP is quite high, and I see this a lot. So one of the things that reduces CTX to the biggest extent in my clinical practice is hormone replacement, and even just working on hormones to just kind of going low and slow with hormones like DHEA and maca and boron. I can still see when the estradiol raises, even from a low postmenopausal range of like 6 to 12, I see the CTXs come down. And then I see an improvement in the DEXA scan. So I can say that in the right hands and interpreting these in the right way, these can be very predictive.
Yeah, the other wonderful thing is, some people may not get a bone density minimally once a year or even every 2 years, where these you can do, within 3 months or 6 months, depending upon what. And it's just so helpful. So this is something that, I think doctors just a lot of times don't understand the value, but I've seen it. I mean, to me, this is just non-negotiable. And you made a very, very good point that a lot of times people just look, what are the red things? So if you look at the values, they may say normal, or it may not pop out. But what you're saying, that's not really accurate in terms of what we're looking for. So you have to go beyond just does it say, just what's popping out that you need to deal with on the on your results page.
Yeah, and kind of the last point that I'll make is that if you're on any medications for bone loss, you absolutely need to be following these bone turnover markers to find out if the medications are working.
Right, because how sad, you could be on a bone building medication and you're not going to know. Let's say it's not working. You'll know within a couple months, 3 months, you'll know with the P1NP, is it increasing if you're on, like Forte or something or not? And how sad if it does, because they don't always work. And you wouldn't know because you didn't test. Okay, we could go on and on, but I'm going to get off and let you continue. So continue with everything else.
Okay. Another thing that's very specific for people with bone loss, but which absolutely, two things that absolutely have got to be ruled out is hyperparathyroid and a renal leak. So hyperparathyroidism is when there are four little glands that sit on top of your thyroid. On your thyroid looks like a butterfly, and these four glands sit at the upper poles and the lower poles on both sides. And they're like little grains of rice, and they put out this hormone called parathyroid hormone. So when there's hyperparathyroidism, this is when the parathyroid hormone is too high. And when it's high, it is causing the calcium to get leached from the bones, and then the calcium is high in the serum. What you want to do to rule out hyperparathyroidism is to look at the trio of parathyroid hormone, calcium, and vitamin D. And so if you want to go more into learning about hyperparathyroidism, Margie has a great podcast with Diva Boone, who is a parathyroid surgeon, and that is at podcast 165. And I know I've had some success in my students in my program identifying that they have hyperparathyroid in my clinic. And Margie, you have some success with that too.
I have to say, it's so incredible because when Dr. Diva Boone, when she was on the summit, each summit, around 20 people found out, and this had been missing. They'd been losing bone, didn't know the cause. And the problem is the lab values often are normal because, they have like a large range. So a lot of times the conventional doctors aren't taught the values. And so they're like, oh, we'll watch it a little high, no big deal. But a little high, no big deal is a big deal when you have these tumors and they're benign, but they're causing bone loss. So 20 people around each summit found out they had a parathyroid tumor, had had it removed, and can get on with their program, because otherwise you're going to just keep losing bone. So this is so important that it's part of the testing. Okay.
And I can tell you that one of my students, so what was happening with her was her CTX kept going higher and higher and higher. And she said, and she was also a patient of mine. And she said, I don't understand why my CTX is going up. And so then we found out that it was hyperparathyroidism, and she just had surgery a few weeks ago. So it can really be a big deal. And the other thing that you absolutely need to rule out if you have bone loss is something called a renal leak. And what that means is that your kidneys, as they filter the blood, they should be reabsorbing calcium. And you shouldn't have a lot of calcium in your urine. And so what we do is we measure the calcium in over a 24-hour period of time. And if it's over a certain value, then that indicates that there's a renal leak. And this is also bad too, just from the perspective that you can't keep the calcium in your body that you should be. So you want to look at your essential bone nutrients, but unfortunately, a lot of the nutrients that are important for bones are minerals, and so it's not very accurate to look at the blood values of minerals because most really what we're interested in is what are the tissue values of minerals, and so that's not reflective in the serum or the blood. And the reason for that is because the body has a very narrow range for the minerals that should be in the blood. And we have all of these mechanisms that keep the minerals in these very narrow ranges. So what will happen is, let's say that the calcium starts to go down in the blood, then calcium will get leached from the bones or other tissues to bring the calcium into range. This happens with other minerals like zinc and like magnesium. And so it's difficult to actually measure these minerals in the serum. But we can measure calcium. We can measure 25-hydroxy vitamin D. Calcium, again, is not reflective of the tissue values, but if the calcium is very low, then we can look at things like maybe there's some kind of malabsorption going on. And we look to the gut to find out whether or not maybe there's celiac disease, or maybe there's some H. pylori infection or something like that. B vitamins are very important for the bones. And so there's a couple of different markers that are pretty easy to look at. MCV is the width of the red blood cell. And when the red blood cells are small, then that's iron deficiency. And when the red blood cells are big, then that's B12 folate deficiency. So you can get MCV as a part of just a normal complete blood cell count, which your doctors will do usually once a year for you. And you can see whether your MCV looks like you have some B12 folate deficiency. And then there's homocysteine. And homocysteine is a functional marker of B12 and folate status. So if homocysteine is high and MCV maybe is a little bit on the high side of normal, then you can know that B12 and folate are functionally not active. And this could involve a genetic pathway. So if you're not activating your folate correctly, so that would be through the MTHFR gene activating folate to 5-methylfolate. If you're not doing that because of this genetic SNP or single nucleotide polymorphism, then homocysteine will be high. And so this is just a good surrogate marker for how your genetic pathways are working through that folate cycle. And so then you'll need to make sure that you get a methylated folate or a methylated B12. And so this can be important and give you some insights into what's happening. Also, I like to look at 24-hour levels of urinary oxalates and urinary citric acids. And oxalates can be a problem for some people. It's not a problem for everyone with bone loss. But what I like people to do is do a quick determination through an app like Chronometer, how many oxalates they're getting in their diet, and then evaluate for oxalate symptoms. And if their oxalates in their diet are high and their oxalate symptoms are high, then they do the test for the 24-hour oxalates and for citric acids, because that is something that combats oxalates. So one of my favorite functional medicine tests is the GI map. And we really are looking at the microbiome and whether there is unfriendly versus friendly bacteria and what the balance is. And that's super helpful. And what we're finding these days is that we know that there are some bacteria that are really good for the bones. There's a bacteria called Lactobacillus reuteri that can be helpful for bone growth. We're learning more and more about these things every day. And we know that overgrowth of pathogenic bacteria that are in the colon can cause a lot of inflammation in the gut, can cause something called leaky gut or a permeable gut wall membrane. And this can cause things like undigested food particles and toxins and pathogens to breach the wall and to translocate through the membrane into and then to be faced against the immune system. When the immune system sees these foreign objects, an undigested food particle is actually foreign. So then the immune system then has a reaction against it. And then these antibodies will go into the bloodstream, and you will actually see immune dysfunction and inflammation then in the systemic system, including that a lot of our bone cells are derived from immune cells. And so the immune system is talking through the gut to the bone cells. And so our gut metabolism and how we digest is really important to our bones. The other thing about digestion is that if you don't break down your nutrients, and then how can you absorb them, and how can they then get to your bones? So it's kind of a twofold process by which your gut is absolutely important to your bone cells. And so you might need a GI map. I believe that anyone with bone loss should have a GI map, but also if you have digestive issues like bloating or constipation or diarrhea or pain or heartburn, and absolutely anyone with autoimmune disease, because I always look at the gut for autoimmune. So here's an example of the kind of, so for those that are not looking at the slides, what I'm showing here on this chart is an example of different commensal keystone bacteria. What that means is that these are the friendly bacteria. So what we want to see is we want too much of a good thing is not good, and not enough is not good. So we want them to be in a green middle zone. And what the GI map does is it gives you a graphical description of where your commensal or friendly bacteria are. And so you can work on those bacteria that are low and work on the bacteria that are high through taking different kinds of probiotics, whether those probiotics actually have the commensal keystones that you're looking for, like lactobacillus and bifidobacterium. They're available as probiotics, and also Akkermansia is available. But also you can take probiotics that just increase diversity, and these are the spore-based probiotics. Then I'm also showing a screen from the GI map, which shows the opportunistic or overgrowth type of microbes. And so here you see what's really great about the GI map is it is a real-time quantitative PCR, and it actually gives you numbers of, and what we're looking for here is the DNA of that particular organism in the stool. And so we actually get the number of counts against the reference. So here I have Pseudomonas. This is one of the opportunistic bacteria that was flagged as being high in this patient's GI map. And this Pseudomonas was 1e⁷. And that is really high. And that was compared to the reference of 1e⁴. So if you remember in scientific notation that e⁴ is 10 times 10 times 10 times 10. So e⁷ compared to e⁴ is e⁻⁴. That's 1,000. That's 1,000 times 1.1 is 1,130 times too high. And so what I do is I not only look at the high bacteria, but I also look how high is that bacteria. And I then go and I start to treat the bacteria that are highest concentration. And I'm hoping that those concentrations go down over time. This is one of my favorite parts of the GI map. It is the intestinal health markers. So we're measuring steatocrit. Steatocrit is how much fat is in the stool. You should not have any. And when you have any steatocrit, this means that you're malabsorbing fat. This is not good because some of the most important nutrients that we have for our bones are fat-soluble vitamins like vitamin D and vitamin K. And so, and actually, let's add in vitamin E as well with the work that Dr. Barry Tan has done. So whenever somebody has this high steatocrit, I have them take a digestive enzyme called lipogold, which has lipase in it, and it helps them to digest their fats better. I've had many, many patients whose digestion has completely changed with the addition of a little bit of lipogold. But in this patient has no steatocrit, so this patient doesn't need lipogold, but his elastase is low. So elastase is a surrogate measure for how much digestive enzyme capacity you have. And so you would need some kind of a digestive enzyme to improve digestion in this case, and the GI map tells you that. Beta-glucuronidase, this is a very interesting enzyme that actually is involved in our hormones and detoxifying our toxins. So there is a part of the phase 2 liver detoxification, which is to put a molecule called glucuronate on a toxin to make it water soluble. And what this beta-glucuronidase does is it cleaves off glucuronate, which means then now that toxin is free to recirculate. If it's a hormone, that hormone recirculates through the blood and raises those hormone levels. So we absolutely want beta-glucuronidase to be in a normal level. We're also looking to see if there's blood in the stool, and obviously, for obvious reasons, that's not good to have blood in the stool. Secretory IgA is like your little immune system. These are immunoglobulins that sit at the end of the gut, and it protects you from invasion of pathogens that reach the gut wall. Anti-gliadin is a peptide in gluten. And so when the anti-gliadin is high, we know that that person is reacting to wheat or gluten. Eosinophilic activation protein is an allergic reaction to whatever is out in the gut, and that can be helpful. And calprotectin is an inflammatory marker. I have patients with Crohn's disease where calprotectin can be in the thousands, and for this patient, it's low at 6. Zonulin is a leaky gut marker, so that shows you that you have a leaky gut. And also that zonulin is present in the gut. I'm going to show you how that can be related to a food sensitivity intestinal marker in just a moment.
Hey, Margie here. I love sharing resources that can help us address issues we are facing. And unfortunately, we are exposed to over 100,000 toxins every day. Toxins are hiding in the food you eat, the air you breathe, the water you drink, the products you use on your skin and use to clean your home. It's an epidemic underlying so many of our health issues and something we don't talk about enough. That's why I want to share a podcast I listen to weekly. It's the top 50 highly rated Myers Detox podcast from one of our former guests and an environmental detox expert, Dr. Wendy Myers. The Myers Detox podcast dives deep into cutting-edge strategies for detox, hormone balance, weight loss, fatigue, and brain fog. If you want to learn how to protect yourself from toxins in your daily life, get to the root cause of your chronic symptoms, transform your skin and hair, and hack your metabolism, as well as releasing old traumas, then I highly recommend tuning into her show. Simply search Myers Detox, MYERS DETOX, on your preferred podcast platform. Now back to the show.
So food sensitivities, I really feel like everyone with bone loss needs to be screened for gluten and dairy. So the National Osteoporosis Society says that everyone needs to be ruled out for celiac disease. But what I say is I think that should be a larger criteria. So there is a spectrum with reactions to wheat and to gluten. So the upper end of the spectrum is that person has celiac disease. And most of the time, that is going to involve intestinal damage, and that causes malnutrition and malabsorption. So that's at the upper end of the spectrum. At the lower end of the spectrum is a food sensitivity to gluten or wheat. That gluten is still causing immune reactions and inflammation and immune chaos within the systemic system, but there's likely no damage to the intestinal mucosa, but it's still very important to know whether you have a food sensitivity to gluten. And in fact, what we know is that celiacs tend to have osteoporosis young. So if somebody has severe osteoporosis fairly young in their 50s, or somebody has any osteoporosis in their 30s, you're absolutely looking for celiac disease. And gluten and dairy, they both cross-react. So it's important, I think, to look for food sensitivities for dairies too. Now, my favorite test for doing food sensitivities is something called the food zoomers. And the reason why I like this is because it's very specific. It's looking at one particular protein fragment that's very specific to that food. So there may be some cross-reactivity happening, but not as much as in the technology that some functional medicine doctors do. So again, I think that food sensitivities should be evaluated for anyone with bone loss, absolutely for anyone with autoimmune disease, and then digestive problems. And you can see food sensitivities causing any kind of symptoms in the body: migraine headaches, anxiety, depression, muscle aches and pains, swelling, infection. And so if somebody has some kind of health concern that they really can't get a handle on, I had one patient, she had absolutely no digestive symptoms whatsoever, and she had autoimmune Graves' disease. So this is where she's hyperthyroid because of an autoimmune disease against her thyroid. And her gut GI map was very, very positive. And as we went and we treated all of those gut infections, she went into a remission and she had no gut symptoms. So I think that's a big pearl, that you've got some kind of health condition that you can't figure out. Definitely look at food sensitivities. Wouldn't you agree, Margie?
Oh, absolutely. It's so interesting. I mean, a lot of people listening to my podcast have heard my husband's story. He wouldn't be alive had we not figured out gluten sensitivity. But I see, I've been doing this for over 25 years with people with osteoporosis, and I don't know if you have the same. It's such a large percentage of people don't have celiac, but they do test positive on the wheat zoomer or have issues with gluten. And when they stop, it really affects their bones. So this is something we can't overlook. And, a lot of, as you said, everybody is tested. Most of the conventional doctors will test for celiac, but they won't go to the next step. And that's just a small percentage of people. Do you see that as a large percent of your population, though, that have issues with gluten?
Oh, huge. Yeah, huge. I would say it's a really small percentage of that actually do not have problems with gluten. And I'm surprised when I see that somebody doesn't. It's very, very rare.
It's interesting. On the summit, that was all of my speakers. Everybody said the same thing. So this is such a big thing that's often overlooked. And is, as you said, so when my husband very long story short, when he was able to figure out his situation when nobody could, but now he's an OBGYN. And so when he can't figure something out, he's like, you know what, let's give up gluten, dairy and see what happens. And so many things have gotten better from people because they only see him once a year. They come back, my child's ADHD is so much better, or this is better, that's better. So it's just incredible. Continue.
Yeah. and just reckon back to the bone turnover markers. So you want to look at CTX. If you give up gluten and dairy, you may see your CTX go down. That's really important. Yeah, because food sensitivities are bone breakdown. They cause bone breakdown.
Such a big thing. And if you miss this, here you're working so hard at trying to help yourself, but yet this piece of it is very prevalent, and it's something that you can deal with. That's the good news.
Well, don't you actually think that it's positive reinforcement too? So here you maybe you don't even have any symptoms from gluten or dairy, and you give them up and you, I don't really feel different. And then you get your CTX and your CTX has come down by 100.
Yeah, I think that's so incredible. It's funny because I didn't really have any symptoms, but I don't think gluten is really healthy. Anyway, so when my husband had to get rid of it, I just stopped it. And now if I have it, I will sweat at night. Things happen. It's really interesting. But when I gave up dairy or really and changed my diet a little bit, I got off all thyroid medicine. I have Hashimoto's. So yeah, you can see all these things. But that's exciting about the CTX, that it's really affecting, your turnover. Yeah.
And there's this other factor, right? Which is latency. So some things you'll see right away. So usually the GI effects will be right away, but a headache might be 2 days later, and swollen joints, swollen fingers might be two or 3 days later, or muscle pain, something like that. And so now you're like, was it the tomato sauce that I ate that's causing my swollen joints? Or was it the gluten that I ate 3 days ago? Right. And so it starts to just muddy up that water if you're trying to do this by, like being a food detective. And these tests are just so black and white.
Yeah, it's so good. Thanks.
Yeah. So I'll show you an example of a Zoomer. So this was a patient, but what I want to point out is that there are two different technologies that are represented in this summary results for him. And so there's these peptide level sensitivities that, they're the green, yellow, and the red results bar. And then there are these other IgA, all the way down to C3D. So this here, these are a moderate reaction to IgE for these foods. This is different technology than the peptide level sensitivity here. So the peptide level sensitivity is the technology that's very specific. It's based on small little fragments of the food, and cross-reactivity is very much reduced. And this level of technology, this is looking at bigger fragments, and cross-reactivity can be a real problem with this technology. So I am really mainly focusing on the peptide level sensitivity. And the only reason why I have the other technology that was ordered is because it's a free add-on when you do a bundle. And sometimes you get some interesting information. Like if I were to get some information on IgE is an immunoglobulin that actually represents a true allergy. So that's important to know if somebody comes up with a true allergy to kidney beans, for example. Then that would be interesting to know. But I'm really focused on the peptide level sensitivity. So for this patient, he had high dairy and high wheat. And look at how the buckwheat, they disagree with each other. So you've got a green peptide level sensitivity with a moderate IgA test. So I'm going to trust the peptide level sensitivity. So this patient also had corn in the moderate, and this is an intestinal permeability, and we're going to look at that next. And then sorghum was high, and we have green pepper, kidney bean, and quinoa that also came up as moderates. So one thing that I always talk to my patients about is that sometimes when you get this data back, you get so many foods that you're sensitive to, you say, okay, I don't know what to eat. And that happens a lot. So what I will do will be, look, you can just focus on dairy and wheat because those are your top peptide level sensitivities. And let's just do dairy and wheat for 6 months. And let's do other work that we're doing. And then maybe then you could, and then the other moderates, maybe just reduce the frequency, but don't cut them out completely, because we also have to meet people where they're at. And that, if you've got a mother and she's cooking for her kids, and, it's really difficult for her to take out corn and dairy and wheat and sorghum and green pepper and kidney bean and quinoa. So, I like to just make things practical for people and help them out in that way, because so people will still improve. Okay, so this is a detailed version of what we saw in the summary. This is for gluten and also for intestinal permeability. So if you're not seeing the slides, basically we have a few different categories of fragments that were positive or moderate or negative that we're showing here. And so for the positives on the wheat, we have this patient is sensitive to wheat germ. And then here is glutenin. And glutenin is a fragment on wheat. And so this person is sensitive to glutenins. And then this is a fragment. These are different fragments of peptides that are on the wheat molecule, but aren't glutens. And so these are the things that this person is reacting to, as well as gliadin, another peptide that is in gluten. Here's a really interesting thing. So intestinal permeability, this patient has antibodies to zonulin, and this is a blood test. So they have antibodies to zonulin in the blood. Now, if they had zonulin in a GI map, that's the stool, you have absolute evidence that the zonulin has gone from the gut, translocated across the gut membrane over to the immune system. The immune system reacts, and the immune system antibody to zonulin has now gone into the blood. So you can see that full stream by looking at the GI map and the food sensitivities at the same time. I think that's very helpful because it actually shows the immune chaos and immune dysfunction that is happening in the blood because of this food. And the other thing that's interesting to note here is in this person's negative panel, there's a celiac panel, and there are transglutaminase panels and deaminated gliadin panels. And these protein fragments tend to be high when there is destruction of the gut mucosa or the gut lining, and this causes malabsorption. So it's always of note if any of these protein fragments come up, because this is more into that spectrum closer to celiac disease. And so it's good that this person did not have any of these proteins come up. So blood sugar and insulin resistance is absolutely important, even if you just have prediabetes. So prediabetes would be an A1C of 5.7 to 6.4 and a fasting glucose of 100 to 124. You can have a 24% increase of fracture rate just from having prediabetes. And I have so many patients who they go to other doctors, they look at their data, and they go, wow, your sugar looks really great, and they're pre-diabetic. Just based on their fasting glucose and their A1C, they're pre-diabetic. And so they get the wrong impression, right? I mean, that's not going to be optimal for their health. It's definitely not going to be optimal for their bones. And one of the things that happens with blood sugar and insulin resistance is we get these AGEs, which are advanced glycation end products. And these AGEs, they're basically sugar molecules that attach to proteins, and these proteins become brittle. And guess one of the proteins that becomes brittle? Collagen. Well, collagen is in your bone matrix, and that makes your bones brittle. So there's a lot of things that can happen with sugar dysregulation and the bones. So what are the things that we're looking at? We do really a deep dive into sugar, because I'm going to give you an example of where you really need to do a deep dive in order to understand the full extent. So we do an A1C, fasting insulin, fasting glucose, an HDL, and a triglycerides. And so many of these markers your doctor is already doing for you. The way you interpret them is important. So here's an example. Patient has a fasting glucose of 84. Optimal is 80 to 90. So optimal fasting glucose. A1C, optimal is 5.2, 5.4, 5.6. Patient has an A1C of 5.2, optimal. Triglycerides 110, anything over 100 is a little bit high. So this is a little high. HDL, which is the good cholesterol, is 55. Anything over 50 is good. So this is good. Triglyceride to HDL ratio, 110 to 50 over 55, which is 2. This is slight insulin resistance. Insulin is 12. This is severe insulin resistance based on an insulin of 12. And the HOMA-IR is the fasting glucose times the insulin divided by 405. And with this patient, it was 2.5, which is moderate insulin resistance. So with a fasting glucose and an A1C, they're absolutely moderate. If you don't dig deep enough, you won't see that this person is moderate to severely insulin resistant. And don't you find that interesting, Margie?
Yes, I absolutely do, because most times you would never, and people just don't order unless there's some reason. They really don't order the, they don't order the fasting insulin. So I think, and I agree with you, a lot of times, as long as it's not diabetes, they're like, oh, you're fine. And they just wait until it's diabetes. But as you said, a 24% increased risk of fractures. That's horrible. And the other thing that's so great is there's so much there's so much that can be done to improve the blood sugar on your own. I mean, there's just so many little tweaks that we can all do if we know it's an issue and that this is affecting our bones. So yes, I think this is so important. And you taught me that. Ever since that, I've been always adding my fasting insulin to my blood work. So yes, so I have to thank you for that.
Yeah, I think it's really important. So what else can we do for our sugars? I'm a big fan of the continuous blood glucose monitors. Most of the time you're going to need a prescription for this, but there are vendors out there now that are direct to consumers. And so what is this going to help you do? You're going to get real-time data on what is happening with your sugars for particular foods. So you take a baseline measurement and then you eat your food, and then you find the peak of your blood sugar. This is called your glucose spike. And then that's your glucose peak. Your spike is the peak minus your baseline, and your spike, you want to keep to 30 points or less. And so you can find these foods, you can tweak, you can find, okay, say that you have an apple. Then one thing that helps to round out your blood sugar is if you add protein, fat, and fiber with your carbohydrates. So you eat an apple and your glucose spike is 50, which is above 30. You could add a little bit of almond butter and a little bit of cinnamon to that, and then you could recheck it. And if it comes down, if your spike comes down to 30, you know that that's a tweak that you can do to help lower your glucose spikes. And there's food order. You always want to eat your carbohydrates last. And by eating your carbohydrates last, you can decrease your glucose. There was a study in 2015 that showed that your glucose spikes could reduce by 40% and your insulin spikes by 50%. So that is a really, really important thing that you can do. And there are other things that you can do to tweak your sugars, and your continuous blood glucose monitors can really help you to see the evidence of it. And so absolutely, you want to do this if you've got any issues with your insulin or your A1C, or maybe you even just feel like your blood sugars might be unstable. Maybe you're a little bit dizzy, or you get irritable when you're hungry, or you have some anxiety or headaches. Just being tired after a meal, or being achy after a meal. Sleep issues, like blood glucoses can go down in the middle of the night, and that can wake people up. So low sugars can be as much of a problem as high sugars for quality of life issues. And just that instability of the glucose is important, for your overall health.
Yeah, I just want to say one thing. I am such a big fan of this because my blood sugar started getting into the pre-diabetic range of my A1C. And I'm like, what is going on? I eat so healthy. And for me, it was that I was eating a lot of fruit. And once I added nuts to it, once I just added more protein and fiber, I was able to change it. And then you see what foods, and it's different for everybody. So it gave me so much information that I was able to make the changes, and it totally affected, it improved my A1C. So I just can't say enough good things about it. And it's so much easier, than pricking yourself all the time. And you really get to, and it's different for every person. So big fan of this.
Yeah, super powerful. And so most of you probably know that inflammation is important in all metabolic diseases, including cardiovascular disease and diabetes. and inflammatory disorders like lupus and rheumatoid arthritis. But one of the things that you may not know is that bone disease is a metabolic disease as well. And so it's important to measure inflammation in the body. And one of the key ways that I do this in my practice is by measuring CRP, C-reactive protein. And I get the highly sensitive or the cardiac CRP. And your doctors may be doing that once a year or more. I do it at least that often. And when I'm going to follow a natural intervention, I may do it every 6 months to see if my intervention is working. So I've developed an interactive lab testing tool. And what I've done is that I've included all of the tests that I like people to get for, and this is the way that I follow my bone disease patients in my practice with these are tests that I do through the blood and through the urine, things like our bone turnover markers like CTX and P1NP, and I have my own optimal ranges that you can see. And so what you do is you put in your lab results, and then you put in the date of your test, and then the interactive web tool will actually figure out whether that is optimal or not, and then whether depending upon whether it's optimal or non-optimal, it'll let you know whether it should be repeated or not. And so I think this is a really good way of following your lab tests. And I even have people who will bring these into my clinic, and they've got it all filled out, and they're following, and they pretty much know whether they need to repeat this test. And then that helps me to keep everything organized as well. The column on the right, as far as what the dates that they're ideally needed by, that is with respect to the program that I'm running at this point, which will be done in the end of June. And so those will be updated in a few months. So you can get this interactive lab testing tool for you to use as much as you like for free if you go over to the millmanclinic.com/healthy bones.
I just want to say something. There's so many people have thanked me, Dr. Millman, because, they brought it to their functional medicine doctor, or they've just been able to, it's been able to help them understand their blood work. It's just a wonderful tool. So thank you. I'll also have that link in the show notes, but thank you so much for doing that. And people have really, really appreciated that. And thank you for giving that free to all the podcast listeners. So thank you.
Yeah, absolutely. It's a very powerful little tool. And I also want to introduce you to the program that Margie and I have co-developed and co-teach. It's called Restore and Rebuild 100 Days to Healthier Bones. And this is a 14-week program. There are 14 live sessions. 10 weeks are content-filled, and 4 weeks are integration weeks with a Q&A. And so you have handouts and self-assessments and lab trackers. You have your content every week, and there's so much information that allows you to actually take the information that you have learned and then apply it to your own situation and help you to interpret your own labs, and then to learn the different kinds of treatment modalities that I use in my own clinic, and for you to follow that and come up with your own personalized Healthy Bones protocol. And this is really based on the protocols that I use in practice over the last 15 years that has had an incredibly small percentage of patients actually fracture or break a bone. And so our new class is going to be starting in September, and it's going to be on Thursdays at 3 p.m. Pacific. And if you'd like to join the wait list, we would love to have you. And so you can find that at the millmanclinic.com/RNR. And on the slide, I made a mistake and I didn't put .com. You'll use the referral code of Fall Margie with a big F and a big M. And if you use that referral code, that will make sure that you get an extra special discount code when we open registration, and that will actually automatically be applied.
I just want to say something really quick, is that the reason Dr. Millman created this was that, unfortunately, there aren't Dr. Millmans everywhere, functional medicine doctors who take this integrative approach, because you're listening and you're like, oh, this is great, but where am I going to find this doctor? And you can see her if you live in California, but that's not possible for everybody. So we had talked for many years about creating a program, and this was sort of the solution to how can you utilize the knowledge from an incredible integrative doctor and yet do it in a program form with your own testing. And, sure, you can do this in conjunction with, we're still working with your doctor, but this was a way in a group program to be able to do these kind of functional tests. And it worked. I mean, this is now, we've gone through almost 2 classes and people have just, everybody can't thank me enough and thank for introducing me to you and for this program. I teach 2 of the classes on exercise and on stress and happiness. But I think the best part is that at the end of each module, you spend a very long time answering everybody's questions and really helping them along their path. So it's very powerful. Anyway, continue. I had to share how great this is.
Thank you. Well, and then lastly, I have a lab testing guide that is available for $27, and this comes with the program, but if you want to get it now, then you can. And so the lab testing guide, what it does is it shows you all of the codes for LabCorp and Quest to ask your doctor to get these. And you can just provide the codes for your doctor for you to get these tests. And then also direct to consumer companies. There's Ulta and Life Extension, all of their codes, how much these tests cost. And then for the functional medicine tests, the same thing through DHA and through direct labs. And we give you the codes, we give you links, and make it really easy for you to either ask your doctor or get these labs through by yourself. And then and so you can get that at the Millman Clinic.thrivecart.com/essential-lab-testing-guide. It's just another resource for you. And it also goes through this entire webinar.
Okay, then for people, if they purchase the program, they'll be able to get a
Then they'll get the $27 reimbursed.
Wow, Dr. Millman, this is great. That's a lot of information. No one expects you to know all of it. You can go back to it. You can, this tool that she created that's free, get that. So then you'll have that to look at your lab work, and you can digest this slowly. It doesn't have to be digested, but I just felt so strong. I mean, I think both of us feel so strongly that this can change. This information that we gather can change the whole course of your bone loss. Why are you losing bone? When you deal with it, and then when you measure it, and because what do you see? You tell us, you've been doing this for so long, measuring. What have you seen when people do this amazing integrative approach?
Well, yeah, absolutely. I mean, I just had a patient last week whose spine went from -2.8 to -1.8. I'm finding, just small tweaks in someone's hormone levels can actually just by doing a little bit of hormone work and some food sensitivity work, their CTXs go down by 100, 150, and their DEXA scans follow suit. And so the bone turnover markers, they can just be so predictive and they're so helpful. And then a lot of this data, I mean, you may already have done some of this lab work with your doctor. So having the interpretation tool then can give you the kind of, that's really the optimal ranges, looking through the lens of somebody who evaluates these tests for people with bone loss. And so I think that's really helpful. And then, if you should choose to come and do the program with us, we would love to have you. And we'll help you along the way. And if you don't, then please do everything you can to try to find out your root causes for bone loss. And really, along the way, you'll just, find the healthiest version of yourself. And I think that is, so special.
Again, I just can't say enough how this has helped me. So I personally, besides teaching to the classes, I went to every class, not live, but it was really quite wonderful. But regardless, I think the most important thing is test. These are available and it can really make a difference in your care. And I think, look, May is Osteoporosis Month. I want people, it's doable and there's so much that can be done. And, not only will your bones improve, but every aspect of your life. So thanks so much, Dr. Millman, for being with us.
Yeah, thank you.
I hope you enjoyed my interview with Dr. Millman as much as I did. This testing piece is so important. And as I mentioned, often overlooked. When you're listening to this, don't feel overwhelmed that you have to absorb all of it. Just know it's there as a reference. You can go back to as often as you want. Because there was a lot of information covered. I highly recommend downloading her free interactive testing tool because it will really help you. You can put your values in and it gives you great information as you try to figure out the root cause or causes of bone loss. It's very powerful. All the other links that Dr. Millman talked about, including the link to find out more about her next program, will be in the show notes. And also in the show notes, I have the link to my handout that I created on exercise, where I talk about what exercises really improve bone density, balance, posture, as well as what weight-bearing exercises you can do throughout the day to really make a big difference in your bone health. So make sure to download. That's free as well. So thank you so much for tuning in, and I look forward to seeing you on the next episode.